Welcome to Transformative Talks, where meaningful conversations meet holistic wellness. I'm your host, Chelsea Gilbert. As a massage therapist and wellness professional for nearly a decade, I've learned that some of the most powerful inspiration for healing comes through authentic conversations with passionate people who are committed to growth, self-discovery, and helping others. Here, we explore the many pathways to well-being, mind, body, and spirit. Each episode is designed to expand your understanding, spark curiosity, and offer practical insights you can begin integrating into your everyday life. From bodywork and mental health to nervous system regulation, astrology, spirituality, and personal growth, we cover it all. Whether you're just beginning your healing journey or looking to deepen your connection with yourself, this space is here to support and inspire you along the way. Make sure to subscribe wherever you're tuning in from and get ready to transform. Welcome back to Transformative Talks, and I'm super excited today. We have Dr. Jeffrey Bone with us, and he is specialized in some things that are really close to the type of work that I do. And I know we're going to have some really interesting conversations because I think we're both really passionate about similar things. And this is going to be a great listen for anyone that struggles with chronic illness, chronic pain, and just maybe is in the middle of it and doesn't quite know where to go, what to do, how to handle it, how to manage it. This is going to be a wonderful listen for anyone with that sort of stuff going on. So, Jeff, please introduce yourself. Let people know what you do, where you're from, what you're all about.
Well, first of all, thank you very much for having me on today. So I appreciate that. And I'm a chronic illness coach out of Orange County, California. And that is what I do. And I assist people who are living with chronic illness, as I live myself with the chronic illness, through how do we improve the quality of life. I wish I had the cure for chronic illness and chronic pain. We would be having a conversation on my yacht if that was the case, but there are things that we can do to kind of manage our own authorship of our own story so that we can diminish the suffering involved and improve the quality of life.
Yeah, and that reflects a lot. I just was doing some posts recently on my Instagram where I said, healing is a journey, not a destination. I think,
Absolutely.
yeah, I think a lot of people get so wrapped up in the idea of being pain free or being, at the end of what they're experiencing. But life just isn't like that. Even if you did have a
No.
cure for whatever, you're still going to encounter certain things in life that create discomfort and to create pain. So it's like
Yes.
that management part is so important. So how long have you been doing this?
10 years I've been sick. And so I've seen clients for 2.5 decades. But the chronic illness coaching has been much more of the past few years, past 4 or 5 years, and I've had chronic illness myself for the past 10 years, and I have common variable immune deficiency disorder. And how it started was with black mold in the HVAC of my office.
Mhm.
Didn't know it was black mold, and I had this really bad sinusitis. Get prednisone, which is really normal medication to take for sinus infections, and my body flips out. My feet are vibrating, my bladder hurts. It feels like I have this neurological concussion, have this head pain that won't go away. I don't fall into any of anyone's decision tree. Anyone that neurologist, internist, podiatrist, urologist, this is, and it's like, oh, it's psychosomatic. Oh, give it some time. And it's kind of like, and it is so frustrating, because one of the most frustrating parts is that the doctors never want to say, oh, I don't know. Let me refer you to somebody else. They all want to just label you anxiety. Ta-da, I did my job, or they throw out things. I always call it the swag technique, which is the scientific wild ass guess. And so they use a lot of that swag technique for people that just fall through the cracks. And I've seen that countless times with people. You have mast cell activation, you have a connective tissue disorder, and it's kind of like you don't fall into the typical profile. You don't have like the lumbar strain sprain, and it's different. And in this day and age, we have a lot of chronic illness. Doesn't really fit into the system of medicine that we have today. And so these people are just gaslit so often until they find somebody that gets them, that speaks their language, and that can hear them through. And for me, It was very difficult, but I found someone who figured out that it was a mold issue, had the office tested, confirmed 2 species of neurotoxic mold. My body wasn't clearing it, treated a year with that, and I was better, but I really wasn't better, didn't have any good days. And I was going to go to the Mayo Clinic. But I looked at a local hospital and I looked at their directory and going, oh, like, who should I see? Like, I've gone to all the doctors that I know, and there was a toxicologist. I didn't know what a toxicologist was, but I felt toxic. So he doesn't believe anything with the mold. And it's like, I don't care. Just, what do you think? Give me your opinion. And he tests my IgG scores, and which were low. So he sends me to the immunologist. They give me a vaccine. I don't make antibodies to the vaccine. And that's how I end up with common variable immune deficiency, which is treated with weekly infusions of immunoglobulins. And that is derived from when people donate plasma, that plasma is turned into immunoglobulins. So basically, I'm missing a part of my immune system, which is a little problematic. And I can't replace all of it, but I can replace a good portion of it with those immunoglobulins. Still have pretty regular infections, still have fatigue, still have some issues, kind of still walk with a limp metaphorically, but I'm much better off with the immunoglobulin treatment, which I do at home, where I put 2 needles into my abdomen, and it's not going into my stomach, it's just going into the fat of my abdomen, so it's subcutaneous. And so it's my own version of acupuncture on a weekly basis.
So what you struggle with or what you live with every day, it's a byproduct of environmental stuff for you? Or was this something that you were like predispositioned to have, or it was just completely
I
triggered?
was a healthy person up until 41, really. I didn't even have a primary care doctor. I just didn't even go to the doctor. I was an anti-doctor. I just, wasn't all that sick. And supposedly about 20-30% or so, people cannot clear the mycotoxins from the black mold. Lots of people can. So you get this environmental illness. So it's epigenetic. So you have this environmental stressor that causes that gene to become activated. And, it just so happens that, because when I was sick, I was cannot function sick for a long time, really kind of 2.5 years until I get the right diagnosis.
Yeah, that was probably pretty jarring going from not ever really having to go to the doctor to being to where you couldn't.
The doctor, the pharmacy, the medications, the refills, the uncertainty, trying all these gizmos and gadgets. And I've done everything. Oh, hyperbaric and red light. I use ultrasound, red light up the nose, IV ozone, every supplement in the world, liposomal forms of every supplement in the world, because when you get sick, you're desperately trying to run back to the person that you once were. You're trying to get back into that healthy place. And now, as I sit here, I have pain. I have pain in my head and pain in my foot, but they are familiar, uninvited guests. They're very familiar to me, and I'm not stressed and I'm not panicking. I'm not looking for cures. And because at first, we didn't have AI back then, but I was on Google all the time, just looking for answers. What can I
Going down the
try?
rabbit hole, the Google rabbit
Going
hole.
down the rabbit hole. Absolutely. And I would just try just about everything. Throw in a little cryotherapy, throw in this, maybe it's that. You hear the stories, oh my gosh, it was magnesium bisonate. And it's like, that was the thing. It's like, oh, I was just low in vitamin D. It's kind of like, well, that's not the thing. Trying to find some hope, trying to find some level of control, and just kind of flailing like it's my first swim lesson.
There's a huge psychological component to when we feel disempowered like that. What were some of the things that you did that helped to get you through that time and get you to a point where just mentally you were able to kind of manage and handle the things that you were having to do for yourself?
And it's kind of odd because I've never been an artist. That was not my previous avatar. That's not who I really was. I couldn't paint. I wasn't a musician. I had musicians in the family. I had artists in the family, but that was really never my skill set. But when my world collapsed and I was just trying to find some kind of structure of containment for this collapsing identity, I
Mhm.
started writing poetry. And I liked poetry because it didn't really have much in the way of rules. It was like short, easy. It can be as long as you want or as short as you want. And that was my catharsis. That was my emotional release, was just being able to write that poetry. Ended up writing 2 poetry books, and it was just for me. So I wouldn't tell anyone to read my poetry because it's not it wasn't designed necessarily for the consumer market, and it wasn't really like, oh, this side hustle. It was really, I just wanted this accomplishment. I wanted to write it. I wanted to publish it. I wanted to just kind of get it out into the world. And so I did. And then it created then this kind of curiosity. And I think curiosity is so important because you're feeling stuck. Everything is kind of so unfamiliar. It's this unfamiliar land that you get dropped into with no compass, no map. And so I wrote these chronic illness journals. I did coloring books. I was just creating things just out of this curiosity of, I wonder if I can do this. I wonder if I can do that. And then I wrote some other books, and I created a podcast as well, just to find my voice, to find my story, and to be curious within my own personal vessel as I'm kind of caretaking the soul of what resides inside of me.
So, do you ever go back and revisit those things that you created or the poems that you wrote and reconnect with that at all? Or do you feel like once you energetically put that out there into a different container, it kind of served its purpose and then it doesn't do too much?
95% of the time, it's like it just serves its purpose at that moment.
Hmm.
Because when it was written, I don't have that same emotion. I don't have that same pain. I don't have that. So it kind of I feel more disconnected to it, where in that moment I felt much more connected. I felt like this is my little baby here that I'm kind of crafting. I'm trying to make something make sense. I'm trying to make it interesting. So when I go back to it, it just, it feels like that I'm revisiting this distant memory, and it doesn't hit me the same way. It doesn't serve me the same way. It's kind of like, oh, yeah, that happened. Oh, yeah, I felt that way. Oh, yeah. But it just doesn't resonate the way it did as it was kind of emerging out of me at the time when I wrote it.
That makes sense. That's something I see reflected in my journey where I feel like I've grown or moved past a certain point. And then if I revisit a memory or revisit a certain time in my life, it's almost like watching a movie. Like I'm
Yes.
aware that it happened, but I'm seeing it from such a different perspective and from such a disconnected point of view that it's like, yeah, it happened, but it doesn't feel like it happened to me, who I am now.
I got what I needed out of it. I have 2 chronic illness journals. I was curious if I could do it, and then it's like, okay, it served its purpose. If anyone is interested, it's kind of like it sits there and it's available, but it doesn't serve me. I did 3 coloring books, and the 3rd one, again, it's like I was at the tail end of like, this really isn't serving me, or it's not as interesting to me because it's kind of this familiar place, and I've already kind of checked the box of like, I figured out how to do this. I figured out how to make this an actual thing. And so I'll never do another coloring book, and I'll probably never write another chronic illness journal because that was a different time and place. And so it's one of the reasons I like podcasting, because it allows things to be a little bit more dynamic. For a while, all of them are solo podcasts, but I was doing it a certain way. And I'm like, no, I don't really want to do it that way. I want to do it this way. And I can kind of change things, and it allows me to have greater control over essentially the story that I'm sharing, the story that I'm telling. And so it kind of remains interesting for me because I can change it. It's dynamic from one episode to the next. And if I feel like they sound too repetitive, and, to be honest, if you listen to all of my episodes, there would be a lot of repetition in there. In some respect, because we're dealing with illness and identity in over 50 episodes, there's going to be some overlap, and so I needed to make it a little bit more interesting to me. But Podcasting can do that. You can say, well, I'm not going to do that. I'm not going to do it that way. I'm going to do it this way. So it's dynamic.
That's nice though when you have your own thing and you're able to kind of like take that creative control, kind of like what you did with your poems and what you did with your coloring books. It's kind of that same thing, but it's a different medium. I was looking at some of the other books that you wrote, and those are more geared towards talking about chronic illness, kind of like helping people to connect with what's going on in their life, some of your experiences maybe, and ways to kind of manage that. So, if someone was to kind of delve into the books, what would be a good first read for someone that maybe is dealing with chronic illness and is kind of at their first stepping stones with that?
The Restless Waiting Room would be a good one of because it's not a self-help book. It's a self-realization book. It's the, that this land kind of sucks and it's kind of a little frustrating and it's normal to be sad. It's normal. It's not like, oh, these are the 5 tricks to not be sad and this is the 5 tricks to, get rid of that grief. Because the grief is going to be there. Grief is just going to boomerang back over and over and over. When you have a chronic illness, it's not like grief is just something that you process one time. It comes back over and over. And there is sadness, there is grief, there is all these kind of different layers to the human experience, the normal human experience to what this is. And it normally normalizes it and it doesn't pathologize people that a lot of times, and I've seen people where it's like, are they really depressed or it's like a clinical depression or are they just sad it's okay to be sad. And I'm not anti-medication. It's like people can take medications. I'm pro choice, where it's like people can do what they want, but I'm also of the camp of really not pathologizing normal human emotion, not pathologizing tears. People will say, I don't want to cry anymore. It's like, it's okay to cry. You're resisting the tears. It's like, it's okay to be able to, I can imagine with, the work that you do, there are going to be people that are going to have emotions. They're going to have tears. And the word that always stands out is allow that. Don't resist that. Don't try to put it back into like the genie bottle. Whatever you resist is going to persist. So it's like allow it in a safe environment with a safe person and allow that to be that transformative experience. But to know it's just a part of you and it may be a loud part in that moment, but it's not a bad part. And just because it feels bad doesn't mean that you're bad. And it's most often the time, it's trying to protect you, but it's trying to protect you from a past that continues to echo in your nervous system. And so we're just trying to break the echo to that and understanding that, yes, we're going to use all the crayons in the crayon box, all the thoughts, all the feelings. But as normal people do, is that they tend to avoid those thoughts and feelings because they think that somehow that's representative of who they are. I'm a bad person. I'm a depressed person. I'm an anxious person.
Yeah.
In defining themselves by those emotions rather than, no, you have to turn towards and walk towards those feelings and those thoughts to be able to have those somatic releases.
I love how when I ask what book you would suggest to someone just starting out is the book that is helping to normalize those feelings. And I see this a lot with people that come in with me too, where it's just people push it away so hard that
Yes.
every emotion, every feeling we have has a purpose and it just kind of wants to be felt. But when our brain kind of doesn't allow it to process and let go, it loops and loops and loops. And then the brain kind of forgets that it can feel anything else.
Yes.
So it's just getting people comfortable with feeling it in a healthy and productive way versus
Yes.
just allowing it to loop and not really allowing yourself to feel the whole of it.
Hmm.
And that really is one of the first steps in getting your body and your mind connected and on board with, going through whatever process you have to go through in your healing process,
Sure.
whether it's chronic or whether there's another side to it where you can get over something, the first step is definitely feeling it. My daughter said something one time when I was still in massage school, and she was helping me study for my MBLEX. I forget what we were talking about, but she made a comment. She's like, "You have to feel the pain to heal the pain." And I was like, that is so insightful.
That's it right there.
Yeah.
Wisdom of a child.
Yep. Kids are smart.
What you're looking for is usually on the other side of the briar patch.
Mhm.
It's going to hurt going through it. And I know it's going to hurt going through it, but usually what we want is on the other side of that discomfort and pain. I know whenever I do massage work, the way that I carry things in my body, I need those elbows. And, I needed very kind of deep tissue, and it's going to hurt, and I'm not going to like it in that moment, but it's going to be very productive for the rest of my week, and it's going to really change how I carry my body. But if you make it a just pleasant massage in that moment, I'm not going to get what I ultimately need. I'm not going to get what I really kind of came in for. And so I'm not saying that all massage needs to hurt. I'm only just speaking from my own experience of what I personally need in terms of what's going on with my body.
Yeah. And there's a time and a place, and people's bodies fluctuate from day to day. So
Sure.
sometimes people come in and yeah, it's just a relaxation day. Or sometimes they come in and yeah, it's a heavy emotional release day. And then sometimes they come in and yeah, it's a please put your elbow into my shoulder blade
Yes.
kind of day. So it depends on the person. And that's part of body awareness and knowing yourself and knowing what your feelings and emotions are telling you, knowing what your subtle signs in your body are telling you, and being able to take that and direct it into the action that you need to help yourself resolve
Absolutely.
whatever. Yeah.
And I think what's important that a lot of people miss is that we are so individualized in our society. We're so cut off from other people. People who are working with you, they're co-regulating with you. Is, that human touch that is incredibly powerful, because that's literally how we were designed. 99% of our ancestors were tribal, and it would be like 70, 100 people, and we'd be all living together, helping each other out and doing all these different things, sleeping together and hunting together and resting together. But there would be all of this togetherness. And our present society has very little togetherness. And so that co regulation that occurs when you're working with somebody is so important, because whatever pain that they are experiencing, they don't have to carry it completely on their shoulders. It's like you carry it with that person in that moment.
Yeah. And I think one thing that a lot of people struggle with, whether they have chronic illnesses, pain, or whatever it is being able to get into a mindset of being vulnerable and allowing that co regulation to happen.
Yes. No, it's difficult because if there's trauma, if there's, issues in the past, it doesn't feel safe to put yourself in somebody else's hands. And so, and there has to be that trust. It is difficult, but it is so worthwhile. I was watching a video yesterday, and it was, I forgot what country it was in, but this dog who was limping at an injured paw, went to the vet. It was the vet's camera that picked this up. And, it's like they said, like, hey, it's the human. I need some human help. It's the marine life that surfaces by the scuba diver and says, "Hey, take this fishing net off of me, help me out." And they recognize that. Well, we have to do that with other human beings, as well. Like, which is to be able to ask, and it's not a weakness, and it's literally our design. I know when I went to college, I did not ask for help. I didn't go to the office hours I should have. I didn't go to the writing center. I didn't go and really engage because I was too embarrassed. I felt like ashamed that, like, I had the good enough grades, but it was like I could have learned so much more if I put away that ego and shame, and I just allowed somebody. I remember there was an episode of just feeling very depressed in college, and I thought I need to well, if I'm going to help people emotionally, I need to be able to figure out this myself. Well, the answer is that we don't figure things out ourselves, that we do it together. And I was so stubborn, individualistic, and caught. And that's what our society teaches us. It's built on that, Marlboro man, cowboy, that lone warrior. And it's like, that's not who we are. That's just what they're selling us. Who we truly are. We're communities. We're tribes, and we shouldn't be divided.
This is one of the beautiful things I notice about practitioners or professionals that do this sort of work where it's not super mainstream, but it's like a deep healing journey that you go through, and it's a different
Yes.
facet of it. And most of us that get into this work, it's because we directly have experienced the other side of it.
Oh, yes.
And there's definitely something amazing that happens when people come in and you're sitting down and having that conversation with them and they're telling you about what they're going through and everything they're saying. You're like, yep, I understand what you're talking about. I've been through the same thing. Yep, I've experienced that exact same thing. And
Hmm.
I think that opens people up a little bit more to that co-regulation versus going, to someone that maybe has a million degrees but hasn't
Yes.
experienced any of what they specialize in.
Because they try to fix it. And that's the main problem. And here's at first we want it to be fixed. And if it can be fixed, then hey, that's wonderful, fantastic. But a lot of people that I see and talk to, they're dealing with things that aren't fixable. The brain is a problem-solving machine, and when the problem comes up, it's like the loop opens up, and we want to close the loop. But not all things can be closed, not all loops, because that's the nature of chronic illness. And someone comes in with a connective tissue disorder, they have mast cell activation, they have this, and that. You're not going to go, oh, could you just stop having those things? Could you just close that loop? And it's like, no, we have to be able to find that balance. We have to find that relationship with that open loop. And we have to recognize that we're not going to close that loop as we sit here right now. It's not that the loop can never be closed, but ultimately it's okay that the loop is not closed, for us to continue with our story, for us to continue to expand, for us to continue to be curious about what life is or could ultimately be. Because sometimes we get caught in a place of waiting. It's like, I'll live my dream, I'll do this, I'll do X, Y, and Z when I'm feeling better. It's like, life is now. Life is now. However imperfect, whatever it is, life is now. And we can expand within difficult circumstances.
Present moment living is an important
Absolutely.
thing to focus on. So you do work with people that deal with chronic illness, but do you see a particular type of chronic illness that comes to you for help, or is it kind of all over the board?
It's a little bit of all over the board. Sometimes it may show up in the form of CRPS. For some reason, I've seen a ton of people with CRPS, but it can also be very common fibromyalgia, arthritis. It could be migraines. It can bowel disorders. Long COVID issues. It really kind of spans all over the place. It's the imperfect thing of having to manage this continuous problem that can't be just fixed. They have to go in and they get shots on a regular basis. It's always the continuation of treatment, because it's not as though, like, oh, you had this rash and we'll put some cream on it, antibiotic or whatever, and away you go and you'll be good in a few days. And this is when people are caught in the loop for years. And I always call it looking for the corner in the round room. And you're just going around and around. You're trying to solve it, you're trying to fix it. And it's just not solvable to the best of our abilities and for what we know as a species right now. But you're still here, your soul, your identity, your ego, it's still here. And we have to live in the here and now. And so those are the people that I typically see, where they're not necessarily in the place of the traditional DSM, mood disorder diagnosis. It is that they are dealing with these subclinical symptoms of just normal frustration and feeling lost in the forest. And they're figuring out, who am I now that I have this chronic condition, and how do I live with this chronic condition?
So, and I don't think I said this at the beginning. Your doctorate is in psychology, correct?
Yes.
Okay. So, do you approach this with like the people that you see? Is it more from a mental health point of view? Like that's how we get the session started, and then it like gradually goes into the coaching, or people?
No, it's usually from the coaching from the get-go, and it is from the, really, I like using the word story because it's not pathologizing. We all have stories. The country is founded on a story, and like this is a story. What you did over the weekend is a story, and who you are in where you are in this illness is a story. I have a story, you have a story, we all have stories, and we're trying to kind of edit the story a little bit, but very important, not gaslighting ourselves, not using toxic positivity and pretending everything's going to be all right. If it's not truthful, it can't be used because it has no value, because it won't stick. It has no stickiness to it. So we are managing and editing the here and now stories.
So is there a certain technique or protocol or something that you say or something that you do in sessions with people where you can kind of see like the light click and their mindset start to shift or change? Are there any like signs where you're starting to see that with people?
That's a good point. One of the things I typically see is just that people just don't fit into that. It's like I gave them this structure, but people show up in different places at different points in their own story. And I have to, and I'm not trying to ever fit somebody into a box. No, 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 no. We need to start with this point because this is where we start. Well, maybe that's not where they are. I have to meet them wherever their story is. And so that's the kind of the humanistic side of things. And so what I find is that there's that epiphany, there's that click when they realize the story can be edited. We talk about this is not pain management, this is suffering management. I allow them to be recognized as humans, and I see them for where they are, and I'm not asking them to be anything other than who they are. I'm not the healer. I try to show other people how to heal themselves. I don't have any magical powers. I've never cured anything, and I'm not going to cure anybody that I see ever in the future, but I give people tools that they can work with to be able to make this life more manageable.
So, for you, in your own story, what was the point for you when you realized that you could edit what was happening for you?
Definitely the poetry.
Poetry.
Yeah, the poetry was this ongoing aspect of I can use different words. And when you're writing the poem, it's like, oh, that word doesn't fit. I can put this in. Like this rhymes, or I don't want it to rhyme, or this. It's that I could see that I could edit, and I could see that I could express, and I could see that it can be different. Oh, it's going in this direction, but I don't want to take it in that direction. I want to take it in a different direction. And that I felt like I was the narrator, that I realized I wasn't just caught in this kind of undertow of misery, that I could be a little bit more of the narrator of my own existence. But it started off with narrating the poems.
Yeah. So, yeah, that definitely makes sense. Through creative expression, we are able to kind of take back that control a little bit. And we're talking about this. I just hung one of my paintings in my office space. I'm reorganizing, redecorating a little bit. And I want to have a wall with all of my creative outlet paintings
Sure.
that I have. But I mean, there's a reason why like art therapy and different creative therapies are a thing. Like
Yes.
yeah, dancing or any sort of creative expression can really
Anything.
help you to redirect and rechannel the whatever chaotic energy is happening.
It's just stuck. It's just looping around, and it's loops and loops, and it has no place to discharge, and it has no release. It just kind of feels stuck, and it's scared.
Mhm.
And then the fear, the avoidance all becomes familiar and becomes overly familiar. And as it becomes overly familiar, then it doesn't get questioned, and it's just deemed to be true.
Mhm.
This is me, this is my truth, and as if it's been like chiseled into stone, and that it's unchangeable. But once you start painting or writing poetry or expressing yourself, even having a conversation, even gardening, even coloring, whatever it is, you realize there are lots of choices. And it's like, oh, what do you want to paint? What colors? You were going in that direction, but now you want to go in this direction. And it's like, oh, I have this choice. I have that choice. And it's like, and then that creates that snowball effect where the individual is left with greater agency and control over their life.
Yeah, and that is one of the really cool things that I like to bring to my clients' attention. And actually, I'm trying to practice this for myself. I always tell my clients try to take at least 10 minutes a day to reconnect with your body. And I tell people, do it before bed, like everything's done for the day. And
Sure.
you just take that time and
Hmm.
reconnect with yourself. And I'm starting to practice that. And if it's not a habit, it's really hard.
Yes, it is.
To intentionally make that time, but a lot of magic can happen in that space. And I've been doing like a lot of gardening, some dancing, some movement, like creative outlets, things like that
Yes.
to just reconnect with myself. So I love that. That was a point for you where you were having those epiphanies where you were taking
Yes.
control through your creativity. And that's awesome. So you offer virtual sessions, correct?
Yes.
Okay.
Hmm.
Is
That's correct.
your coaching practice strictly virtual or you see in-person
It-
people as well?
no, it's strictly virtual.
Okay.
One of the things was that I had an office, and after COVID, 10% of the clients, came back to the office. And so it's like, I'm paying all this overhead. And because I specialize with chronic illness, it hurts to drive all the way over to me, or they have fatigue, they have diminished energy. If possible, see someone in person, because I think we need that human presence. I think that's
Yeah.
ideal. But I think, if that is not possible for you, or it's inconvenient for you, or there's other barriers to it, I think there's a lot to be gained through a virtual presence. You and I are talking virtually, I can see you, your backdrop, and you can hear the voice and all the rest. And I think there's tremendous value to that. But and I will acknowledge, that there's a difference. But what I do is all virtual.
Yeah. And one thing I notice with people that are doing things to kind of help manage pain or illness, like they're doing multiple things as well. It's not
Oh,
just,
yes.
you're not just getting
It's
coaching
the
or
shotgun
yeah,
approach.
you're not
Yes.
just getting myofascial release. You're not just getting mental health counseling. Like you're doing a bunch of different things trying to figure out what's going to work for you in the moment. So I always
Yes.
really like to have and know and connect with people that offer those different supports than what I have the capacity to do. So yeah, I really like that you offer your stuff virtually because as you're saying that, I'm like, I know some people that would probably benefit from having some coaching.
And I think all people working with people, they're all coaches, they're all therapists, they're
Mhm,
all guides, because they're all managing the story.
mhm,
You educate them to their body, you educate them to where they feel things in their body, where the tension is, and how to work within that body, and that's a story right there. And you're guiding them, and people can be guided in and you have to be careful, because you can guide them in a nocebo direction,
mhm.
where people start having these negative assumptions and that nothing is going to work. It's the opposite of placebo. And so you outthink the benefit. Like, this isn't going to make a difference. This isn't, and it really would make the difference, but you've thought yourself out of it because the doctor said, well, you have degenerative disc disease and you have this, and you have all these different things, and they told you a story of all these problems that you have, and they didn't tell you that 99% of your body's healthy. And so you don't trust your health, because you're seeing it all through the lens of some ICD-10 codes, as if like that's the story of your body, but that's not the story of your body. Those are billing codes. And so you have to go above and beyond, just what is said, but you have to learn. And it's someone like you who is that teacher and that guide to what is going on with the body.
It's hard when we're not taught that when we're younger. But like you said, thousands of years ago when we were all in tribal communities and it was just kind of like we were listening to our intuition, we were connected to
Sure.
the earth, we were connected with all of our peers and it was just having that separation and having that disconnect creates so many problems that we don't even, I think, realize that a lot of it can be solved with just reconnecting with ourselves and reconnecting with people.
Reconnecting with ourselves, reconnecting with people, and I would also say reconnecting with nature. I think nature is I talked about kind of co-regulating with another human being, but you can co-regulate with nature as well. And they have all the studies and all the science, like walking in nature has all these beneficial markers in the blood. And it only makes sense because that's where we came from. We are Homo sapiens, we're mammals. We don't come into nature, we come from nature. And, that's our natural design. And most people don't think about, like, when was the last time that your feet touched grass? Like your bare feet touching grass. Very rarely does anyone ever do that. When was the last time that you were able to sit in the sun it's like our ancestors, they were touching the ground and they were integrating and interacting with it, as well as the weather, as well as the fluctuations of diet and eating within seasons and all the rest. And so we get disconnected because we can always have bananas and apples at the grocery store. We can always keep our office, our bedroom, and our cars at 71 degrees. And it's kind of like we can never be challenged. And so, and have no stressors to our body that way. But that's just not how we're designed. That's not where we came from. That's not the Homo sapien experience.
Yeah, we could do a whole
And then we're one.
episode on that, on that topic.
Yeah, but it's that story of like, and it's like the books, The Restless Human, The Restless Waiting Room, which is just, it's like, is what we're swimming in terms of society, is that toxic? Or, am I failing at things? Because a lot of people feel like they're failing at things, but they're just not really living in an environment that's optimized for being a human being.
Yeah, wow, that was a powerful statement right there. Hopefully that resonated with a lot of people. I know as you said that, I was like, whoa, just so much truth packed into one little sentence. So before we wrap up, is there anything else you want to touch on? Any message you have to anyone that's listening that might be dealing with chronic issues?
That things can get better, that hope exists, and you don't have to cure to make the quality of your life more meaningful. And that there are still these blank pages for you to be able to write your story, and there's still more chapters ahead. And at the same time, I recognize that it's different than what was written in the past. And there is grief associated with that. There's acceptance associated with that. But at the same time, there's still areas to be curious about and to expand. So the story is far from over, and there's more things to explore. And so we don't give up here. We get curious and do the thing that I was terrible at and I occasionally still struggle with. Ask for help. Ask for help. It's okay. It's okay to ask for help. We were designed to be helping each other. And so please, by all means, and if you don't get the help that you were anticipating, walk away from that situation and ask somebody else. I know for myself, I've seen multiple podiatrists, multiple this, multiple that. All my doctors are multiples, because if I wasn't feeling as though I was being heard, I'd go somewhere else. It's okay to go somewhere else.
Yeah, that's all really good. Thank you so much. This was a really good conversation. If you're watching this and you want to know a little bit more about Dr. Jeffrey Bone and some of the books he has put out, some of the resources he has, I will link his information, his website, his podcast. That'll all be down in the show notes. And I appreciate you guys for tuning in. Thanks for tuning in to Transformative Talks. Be sure to follow along on your favorite podcast platform and connect with us on social media so you never miss a new episode. A quick reminder that this podcast is for educational and informational purposes only and is not intended to replace medical advice, diagnosis, or treatment. If you're a holistic practitioner, wellness professional, or someone with a healing journey you feel called to share, I'd love to hear from you. Visit our website, listed below in the show notes, to learn more and to connect. Until next time, keep growing, keep exploring, and keep embracing your own transformative journey.